you can just write your email in the chat box, and I'll be sure to add you.
My screen says there are 30 participants.
Oh, there's already 30 on?
No, it says, I only see 4 on mine, but it says there are not 31, now 31.
How come I can't see my photo?
No, I only see 4
Well,
people.
you probably, that's Kathy, huh?
Yeah, that was Kathy.
I can recognize voices. That's probably because you don't have it on. Let me check here.
There's view options. Look at the top, says view options. Let me click on that. Oh,
I think I'm going to try again.
Zoom ratio fit.
Yeah, Kathleen, you have it on no video. You have your video off.
Where do I change that?
Well, it's going to be either the bottom left-hand corner. That's where mine is, where it has mute.
I just changed. I found it.
Okay.
My screen is very small, but I'll be okay.
At the top where it says view options, mine has your ratio fit to the window.
Right now it's at 50%. And when I increase it,
well, I can hear.
To 200%, it just shows the top left corner of the blue screen. So, fit to window. Okay, everybody just looks small. That's good.
I see Brittany now. I see Linda.
I have to click through the left and right arrows to see everybody one at a time.
You can do that. You can see it. Okay, a lot more people on. Definitely.
I think we should get started.
Already? I thought there was only 4 or so on initially, but if there's that many people on, I agree.
Yeah, there's 33 people, and I think that's pretty good. And it's 5 after 7.
That's
so
good. Very good.
A little pop-up window that says host disabled participant screen sharing.
We only want the presenter to share her screen.
Oh, okay.
So you should be able to see her slideshow.
Good.
Okay. All right. Well, welcome. My name is Brittany Giroudi. I'm one of the members of Plant-Based Pittsburgh, and we also have our president, Sally Lipsky, is here today. I will put in the chat box our website if you're interested in signing up for our newsletter. We have free monthly meetings all around Pittsburgh, and right now they're all virtual. We have our next one is this month on the 21st. It's going to be a cooking demo for plant-based breakfast recipes. So I'll post more information on that at the end of the presentation today if you're interested in signing up to join us again next week. Today we have a Pittsburgh UPMC doctor with us that is lifestyle medicine certified, and that is Dr. Lisa Ference. She's going to be presenting today all about what a plant-based lifestyle can do for you. And I'm going to mute everyone just so that we only hear our presenter talk, but you can type in the chat and we'll take questions at the end.
Okay. All right, thanks everyone. I've not really run a Zoom meeting before, but it looks like our technology is working, so we should be good. As Brittany said, I am a family physician and a lifestyle medicine doc. I've been a family physician for UPMC for over 20 years, and my lifestyle medicine journeys have been a little shorter than that, but it's really been the more exciting part of my journey. I've been doing that for about 2 years now. So I want to go, and I feel like with lifestyle medicine, I have really learned some secrets that I am just sort of dying to share with everyone. So I appreciate everyone here that's willing to listen to what I really love to speak about. To go over first, there we go. The objectives of what we're going to talk about tonight to give you a framework. So first, I just want to explain to you what lifestyle medicine is. And I want to show you how that's a bit different from some of the traditional ways we practice medicine. Now that said, I am still a traditional medicine doctor. It's not alternative medicine, it's not holistic medicine or functional medicine. I'm a family doctor. Lifestyle medicine just kind of puts a different twist on how I look at things and how I kind of approach things. I'm also going to show you how applying some of the lifestyle medicine guidelines could be applied to how we can fight this COVID-19 pandemic. But at the same time, it can help us fight the concurrent pandemic going on, which is the pandemic of chronic disease. And that's going to be around for a lot longer. So the same tools are really going to apply for both things, which is what's so exciting about it. And I also want to help you to figure out what your motivation is, what your goals are, and help empower you to make some of those lifestyle changes if that's what you feel you need to do. So before I get started into the details, I wanted to give you a little bit of history about me and kind of how I got into lifestyle medicine in general. And I think I've always sort of been interested in health and wellness, and it probably stems from having some problems with my weight as early as grade school. I think I was truly the product of the standard American diet, even though it wasn't nearly as bad as it is now. But between that and having a father who's from New York and Italian that just loved his food, I was a fairly chubby little kid in 5th grade. Luckily, one of my partners in crime, one of my girlfriends and I decided to talk our parents into taking us to Weight Watchers, which kind of young for that. I'm not sure that's really what I recommend for children, but at an early age, I at least learned, and it wasn't health related as much as it was weight, but I at least learned what she needed to do to eat less caloric food and not try to gain weight. So kind of always kind of had that struggle. I've bounced around a lot, but even fast forwarding to med school, doctors do not learn a lot about nutrition in med school and residency. It's fairly disappointing. They are making some changes to try to help that these days. But so that all that said too, is if you hear things tonight that sound a lot different than your doctor's ever told you, it's really because they probably have not been trained in a lot of nutritional medicine as well. So that said, I had tried to search, I didn't have a whole lot of time to maybe do deep dives into literature searches and study all the studies myself with practice and raising kids. So I think I would get most of my information that I tried to share with patients from like the news headlines or the bestsellers or shows like Oprah or Dr. Oz. And that wasn't always the best scientific information I probably could be sharing. I tried to do a lot of continuing education courses to learn more, but there wasn't one central place to find what all the right guidelines should be. Until I found lifestyle medicine. At one of my other conferences, a conference I went to about healthy kitchens, so it was a lot about cooking and good nutrition, a representative from the American College of Lifestyle Medicine was there. And they had been around for about 15 years. I hadn't really heard about them, but they were just coming up with the board certification process, a curriculum and a way to teach physicians and other healthcare professionals and get them on the same page about what the science is showing us and what guidelines we should be recommending to patients. But this process was going to take some time and some investment as well. So I thought, well, this is exactly what I want, but I'll just slowly kind of get into this over the next few years. When I got home, I quickly got an email about an upcoming conference that was quite enticing. It was a conference in Costa Rica in February with some wonderful speakers. And anyone who's from Pittsburgh, which I assume most of us are from, would just love to get out of Pittsburgh about that time of year. They also, it was kind of billed as a bit of a retreat / conference. And they promised an hour of mindfulness on the beach every morning before we started. And that was something that I was actually learning more about and was trying to teach my patients at that point as well. So that said, we jumped on that opportunity and haven't looked back. I really didn't know what lifestyle medicine was about. I really didn't realize that they endorsed, because all the science was aligning with it, they endorsed a whole food plant-based diet. So we got there kind of as a surprise, because now they're going to feed us for the week. And after the first lecture, we realized that, and I swear my husband probably looked at me like I had totally tricked him now that we were going to go plant-based for the next week. But with all the information we learned, we watched movies like most of you probably have seen, Forks Over Knives, Dr. Greger's How Not to Die. Some of the speakers included Dr. Hans Diehl, who both developed and produced the CHIP program, heard a number of testimonials about some of the incredible life changes that the participants had gone through. And after learning all that information, we really couldn't look back. At the end of the conference, my husband and I looked at each other, we can do this. And we came home and we haven't looked back. We've been doing plant-based, not 100%, but pretty good ever since. And I felt like I've had a whole new set of tools to help my patients with at this time. So again, I'm really excited to share this. Excuse me. So what these are here, this is one of our logos, and you're going to see me use a number of these slides that are from the American College of Lifestyle Medicine. And the reason I'm doing this is because these are all downloadable on their website. So I'm not going to read all the details of some of them, but just know you can go back and download them from the website if you want some more information. But lifestyle medicine entails 6 different pillars of these different lifestyle choices. It's an evidence-based practice that we aim to prevent, treat, and even reverse disease by helping patients make changes in lifestyle that will help. We really try to treat the whole person. We try to figure out what their goals are and what, to create the best optimal health that we can with them. And the other important part is that about 70 to 80% of what we see in the office of chronic disease is really lifestyle related. Even a lot of the cancers can be linked to lifestyle choices. So if you think about that, that's about 70 to 80% of our healthcare dollars are really going towards illnesses that we've kind of caused by our lifestyle choices. Yet we just kind of, use more research and development money to try to invent cures to undo what we've already done. So I think if we can instead get to some of these root causes, which is what lifestyle medicine is all about, can be much more beneficial here. So this is just the flip side. I'm not going to read all these, but I will go through these over time. These are some of the specific recommendations in each of the areas that we talk about. So one of the concepts we use a lot in lifestyle medicine is that we try to address the root cause of disease. And this picture shows 2 fairly unhappy looking physicians that are sort of just mopping up the floor day after day. And I think this is a big reason for burnout. I think we spend a lot of time treating symptoms and just kind of putting Band-Aids over that. And it's more of sick care than it is health care these days. Where what we really need to do is get over here and try to turn off the sink so we stop flooding the floor. And our goal in lifestyle medicine is to help identify the lifestyle measures that contributed to that disease process, connect the patient, and help the patient understand that and encourage them and empower them to make changes. Traditional medicine, it's like the patient comes to the physician and expects to be treated, and it's up to us to fix everything. And these days we can't fix a whole lot just by pills and medicine. Patients come in and if one heartburn medicine doesn't work, oftentimes they want something stronger when really it's going to require some lifestyle changes to really make a difference. But with lifestyle medicine, if we really can turn off this faucet, if we can get to the root cause of things, we can not only treat, but possibly reverse their disease. So that's been quite exciting approach to things. It also, we act more like coaches, I guess, than just the experts kind of pointing our fingers at them and advising them to do things. We try to, together figure out what the solution is and help them problem solve and agree to the plan we want to take with things. Another important concept is the body can actually heal itself if we just stop damaging it. One of Dr. Greger's sayings is that, if we stop poking ourselves with our fork 3 times a day as we eat our standard American diet, we might give the body a chance to heal. So that's another, concept we go with. Disease reversal is another big component of it. And that's something that we don't talk about a lot in medicine. I'm not sure I really had ever heard a lot of this information, and it's been around since the 90s. 2 main physicians that have done a lot of work in this are Dr. Dean Ornish and Dr. Caldwell Esselstyn from the Cleveland Clinic. And these are coronary arteries. They're the arteries that are around our heart that when they get blocked, a patient can have a heart attack. This particular one is the LAD, which is the widowmaker, which most of us have heard about. This one is very narrow. This is probably full of plaque and cholesterol and, you know, probably very close to becoming a heart attack. Usually we talk about stents and cardiac bypass surgery and all kinds of aggressive procedures to fix that. Whereas those procedures really don't do a whole lot to lengthen a person's life unless they're having a heart attack at the time. When you're doing an emergent angiogram, sometimes that can help, but otherwise all these stents and procedures we do help treat the symptoms. They really don't treat the underlying disease process. Whereas with lifestyle medicine alone, this artery went from this narrow to fully, you know, filling over here. So that kind of information to me is just incredible. I mean, Dean Ornish has even gotten his program approved by Medicare, and you need a whole lot of evidence before Medicare usually approves a lot of things like this. So again, this is kind of, once I learned a lot of this information at the conference, there's sort of like you can't unlearn it. You know, it's really makes a lot of sense, and it's really a direction. It's much more exciting to go to help patients. The other one is food as medicine. Instead of just prescribing a lot of pills, trying to get to the lifestyle and the food choices that we're contributing to things. And in addition, using lifestyle prescriptions, exercise being one, but sleep and all kinds of things to try to help. And getting the patient to agree on what the goals are, not me just telling them you need to do this. You know, it's you kind of negotiate back and forth, how much exercise and how can we specifically get that into your routine. This is another, I know this looks very scientific, but this, you know, when you realize that what they're educating and telling you about really makes sense down to the molecular level, and the science is there to support it, I mean, it's much more believable. So this is called epigenetics. This is demonstrating epigenetics, and it's pretty much saying our genes are not our destiny. We might have a certain set of genes that we've been dealt, but it's really what turns those genes on or off that will determine whether or not we get the illness. Even when it comes to the dementia gene, the ApoE gene that we hear talked about, it's the lifestyle factors, these epigenetics up here are the switches that turn things on or off. So we really have a lot of control. Another saying you'll hear a lot is that, you know, genetics may load the gun, but it's lifestyle that pulls the trigger. And that's so true. And that's, I mean, my own father that I talked about that, you know, loved his food, he is probably a prime example of a failed lifestyle medicine case. And I'm not his physician, so I'm not taking credit for that. But his father died in his 40s, so he assumed that he'd be dead in his 40s too. And so he made all the choices to eat what he wants, smoke, all of those things, not really, no one ever explaining to him that his lifestyle choices are what's going to determine his destiny, much more than just the genetics that he inherited. So this is what my patients are probably coming in all the time. Doc, I can't help it. It runs in the family. And no, it's really not that all those things run in the family. It's that no one runs in the family. And it's probably that you inherited a lot of recipes, more so than the genes you inherited. So let's kind of try to transfer this to how these different factors and those 6 different domains can help us fight COVID, okay? But before we do that, we really need to know who our enemy is. And that's really the hard part here. Because this is a novel virus, we're learning as we go. We only know so much about it. We can try to apply some of what we know about the body's health and immune system as a whole, but we can't be sure that this virus is going to follow suit. But what we do know, we know it's a respiratory virus. We know that it's spread through respiratory droplets that we either cough, sneeze, or sputter out of our mouth or our nose. We know in order to catch it, we either breathe it in or we touch these droplets on something and then inoculate ourselves, infect ourselves in our mouth, nose, or our eyes with it. We also know, and this has been why this disease, why this particular virus has been so hard to control, we know there can be asymptomatic, meaning having the disease but not having any symptoms, and at a time when you can shed virus and infect other people too. People can be totally asymptomatic or up to a week before they get symptoms, they can be spreading the virus. So that's what has made this much more dangerous and spreading a lot quicker into more people than the flu alone. So from what we do know, we've been told then to wash our hands. And why that's important too is this virus is kind of encapsulated kind of in a fatty layer. And by really soap and water, washing your hands in a whole 20 seconds is what science has showed to help. And you've probably heard that a million times by now, but that is so true. Hand sanitizer is good too. You want to have at least 60% alcohol if you're using hand sanitizer, but hand washing is even better. We've been taught to use a tissue or our elbows or something if we cough. If we do use our hands, obviously to wash our hands again and avoid touching our faces because it doesn't go through our skin. Our skin is a pretty good barrier. But if we then, from our skin, touch our mouth, nose, or eyes, we can infect ourselves with the virus. We've been now told to wear masks, and remember that the masks are better, or they're protecting more everybody else. So everyone sort of has to wear them to be helpful. You're only protecting yourself a little bit from wearing a mask. It's really that you're not then sputtering out these respiratory viruses in case you're infected and don't know it. I mean, the N95 masks are protective for you, but they're fairly limited and used mostly for healthcare workers that are specifically dealing with COVID patients. What I think a mask does help with to some extent, though, I think it helps probably prevent us from touching our face as much. Once we have that mask on, we're probably not fussing with our face, which is a good thing. And we've also been told to social distance because we know how far droplets spread and that sort of thing. But I want to talk about what other weapons we have individually even about, that would help us fight COVID. In case we were to get the virus, because it's going to be around for a while. There's, I think we can only probably hide in our homes, for so long. So what else do we know? Well, we do know in general, as I said, how our bodies responded to other infections. And we know that the healthier you are, you stand a better chance to not have as bad of an outcome from infections. Those of you might recognize the name T. Colin Campbell. He wrote the China study. In addition to all the information we do know about the China study, he also studied hepatitis B virus. Now, that is not COVID virus. We don't know for sure that information is going to apply to corona COVID virus. But what he learned with hepatitis B virus, both in the lab and then in the field, is that folks who had more animal protein were more likely not to produce antibodies. So we want to produce antibodies to fight it off. And they were also the folks that more likely developed liver cancer. Whereas the folks that ate less animal proteins had less liver cancer and produced more antibodies. So that idea of producing antibodies is kind of why we take an immunization, why we take a vaccine. We're hoping to put a little bit of it into our system so our body then produces the antibodies. And that shows a healthy immune system if we produce a good amount of antibodies. I've been doing my best to try to see what some of the experts are saying as far as the fight to corona. Dr. Michael Greger has some information out on his website. Dr. T. Colin Campbell's given a few different talks. Dr. Bernard. So I've tried to not just guess at what we think is going to help, but see what some of these experts have been saying. Another thing we know, we've all heard about, these are some of the risk factors. The folks that have some of these these pre-existing conditions, and the folks that are of advanced age have done worse. They've had some more severe cases of COVID-19, or they've died from COVID-19. We've heard the high blood pressure, the heart disease, diabetes, COPD, which is emphysema usually from smoking. The one that's kind of scary is this BMI of 28. BMI is a calculation of height and weight. Anything over 25 is overweight, but it's not until it's over 30 that it's actually in the obesity category. So this isn't even an obese BMI, as well as the average American has a BMI higher than that of 29. So I think sometimes when we've heard about these deaths and these otherwise, healthy people, at least from what they're telling us on the news, I've often looked at the pictures of those folks, and a lot of those folks look like they probably were at least overweight. Not all. There are definitely some of these, very healthy, stellar-looking folks that have also had very unfortunate cases. But I think this has a lot to do with the morbidity issues as well. And so what else do we know about these diseases? We know these folks probably have a more weakened immune system. That's been shown in other kind of studies. We know that most of these are lifestyle related as well. So our pillars of lifestyle medicine would probably apply to be able to not only try to prevent, treat, or reverse these illnesses. Even if someone already has one of these, making changes to either optimally treat or start reversing this would be very helpful. And I know you'd say, well, how long does that take? Well, we've seen significant changes in some of people's biometrics, like their blood pressure, their blood sugars, weight, all those things within a 2-week period of time. And we also know the coronavirus is going to be around for a while. So even if we're not trying to, able to protect ourselves in the next couple of weeks, if this is still around in a year, surely by then we want our immune systems to be, kind of functioning at its optimal levels. The other thing they showed is in diabetics even, there's a study that showed that the diabetics who had better blood sugar control actually survived a lot better. So, even within the range of diabetics, the better controlled everything was, the better. The issue with the BMI of 28, those folks had 6 times the risk of having a bad case of COVID-19. And the only other one of these risk factors that was that high was the COPD, which again is from smoking. These other ones were in the 2 to 3 times the normal range. So again, that's information we do know. Let's see here. So how do we work on the immune system? Well, the immune system is quite complex. And we want to be careful to not specifically say we want to boost just one arm of the immune system or just one of the cells in the immune system, because there are a couple other things we do know. There have been 2 findings on the immune system they figured out so far that are a little perplexing, but kind of give us just some questions, I guess. One is that immunocompromised folks that are on these immunosuppressant medications, your MS patients, maybe your lupus patients that are on medicines, and you'll hear biologics talked about on the commercials and such, but those are medicines that suppress your immune system. Usually we think those folks are much more at risk of getting infections and doing more poorly. For some reason in this case, those folks haven't done as poorly. And that's even why the drug hydroxychloroquine has been looked at as maybe something to help treat. And I think the trials are very mixed on that right now. I'm not necessarily recommending it, but that whole idea of potentially trying that is because, again, these folks that were already on medications like that, despite us thinking they would do worse, have done a bit better. The other piece of immunological data that we do know is that when the folks that get the really bad respiratory symptoms called adult respiratory syndrome, what's happening there is this cell here, the natural killer cells, are producing a whole lot of cytokines, and they call it a cytokine storm. It's like way out of control. And with doing so, they then produce a lot of this gel-like material within the lungs. And they really do feel like they're drowning because their lungs are filling up with this almost like a jelly-like material. So again, that kind of makes us pause and wonder too. We don't want to specifically talk about taking a certain drug or supplement that's going to boost maybe just one arm of the immune system. What we really want is an optimal immune system all the way around, and we want a smart immune system, so it's regulating itself and not going haywire, so to speak. So that said, what are our healthiest weapons? Well, I'm going to bring us back to lifestyle medicine pillars here. And I think good nutrition, and I'll talk about the specifics, sleep, exercise, avoidance of substances, stress management, and relationships. And I'm going to go through each one. And again, these are some of the things that you can download from the American College of Lifestyle Medicine if you're interested in those details. And they have all these infograph kind of things here. This is a nice summary as well. So I will start though with sleep. Let me just get to the right place. There we go. So we know folks that do not get adequate sleep, that truly does suppress their immune system. We need sleep for our bodies to repair themselves, to refresh themselves, even to have energy. to be able to pay attention and focus during the day, to make good health decisions after a while. We know when we don't get good levels of sleep, there's certain hormones that we don't produce that could then lead to obesity. Some of those hormones help control our appetite, help control letting us know that we're full, help us burn calories. So although we often hear that obesity leads to sleep apnea, it's actually sometimes that folks that have sleep apnea and aren't getting into good levels of certain stages of sleep actually develop obesity from that. So sleep is very integral with good health in general. And then obesity can lead to a lot of other chronic diseases. So the guideline is to try to get 7 to 8 hours of sleep. And this is something, you know, as far as like take homes from the lecture, this is something we can go home and really try to get ourselves in a schedule and get our sleep back in order. So I know that's easier said than done for some people. Oftentimes a lot of people do struggle with sleep. So I'll make a couple suggestions, but if it's beyond that, sometimes talking to your physician is another option as well. One is to just try to get back on the schedule. I think we're all off schedule a bit with not knowing what day it is when we wake up, kind of rolling out of bed, jumping on the computer, whatever we're doing at home these days, but trying to keep to a schedule so we're not staying up late one night and getting up early the next. And the more our bodies can kind of the biorhythms can be on the schedule will help. Also, make sure we use the bed for sleep. We're not like there with our laptops doing work on the bed, doing all kinds of other things. Kind of your bedroom should sort of be the area your mind knows now I'm getting ready to rest and relax. Avoid caffeine, especially after noon. Another big one is screens. All the screens we look at all day long, whether it's TV, computers, or phones, they emit blue light. And when we're looking at all that blue light, it's telling us that it's daytime. So about an hour, or I would argue 2 hours before bedtime, you really want to try to avoid screens. And I know most of my patients tell me, you know, they're watching TV until they fall asleep. And they oftentimes can fall asleep, but a lot of times they wake up after that. And that's because now the brain, you know, up until 11 o'clock at night or whatever, has been told it's daytime. And you're not producing the right amount of melatonin, and therefore not getting good levels of sleep. On that same note, you probably do want to try to get outside in the afternoon, if there is sunshine out, that is, but try to get some sun. So again, at the right time of the day, you're telling your brain it's daytime. It's producing the right amounts of melatonin, and you can get into a good sleep cycle. Exercise is something else that's just wonderful. It helps one sleep. Let's see here. Things like meditation, mindfulness, those have all been good ways to help train what we call our parasympathetic nervous system. I think we live a lot in what we call our sympathetic nervous system, which is our fight or flight. And we have that for a reason, but we shouldn't live there all the time. That should be when the bear is chasing us. We should fight or flight. We shouldn't, you know, I think with everything, even before COVID, but even more so now, we live in that state that our bodies no longer know how to relax. We don't know how to engage what we call the parasympathetic nervous system. And things like meditation, mindfulness, all those things help rewire that portion of our brain so that we can relax and we can wind down. If all else fails, I think a little bit of melatonin, especially if you've just gotten off cycle, if you've, you know, been staying up late and doing a different schedule. We use melatonin even for jet lag when you're kind of crossing time barriers. So small doses, 3 milligrams, taking them maybe 2 hours before bedtime might be something just for a week or so that might help. But I think trying to work on what we call our sleep hygiene is even more important. So then on to stress reduction, and there is no lack of stress these days. There is a lot of fear, uncertainty, grief, just, you know, anxiety looming everywhere. You know, you turn the TV on, you can't get away from it. We have to figure out though how to best handle that, because what's happening with all that stress is your body produces all kinds of extra hormones, cortisol, and all those things that are leading to a lot of inflammation and can lead to chronic disease as well. We really are, you know, we need to figure out some ways, and that's easier said than done, no doubt. One of the disciplines that lifestyle medicine has used is a new practice of positive psychology. And that would be something to maybe look up. I'm not going to go into a lot of detail, but they've realized that folks that stay more positive are just more resilient. They're able to get through hard times better. And they've actually studied that you need about 3 positive thoughts for every 1 negative thought in order to have that resiliency. So again, trying to do things, and there's some different techniques that they talk about. One is as simple as trying to count our blessings. And I have my patients, I tell them, put a journal by your bed, wake up in the morning, and I want you to write 5 positive things about that day. So maybe we start the day with positive thinking. Other ways to do that is to realize what your signature strengths are. We all want to be good at something, be purposeful. So if you figure out where your strengths are and be able to use that. In that same sense, try to do kindness and do random acts of kindness for others. During this difficult time, we see all kinds of TV examples of folks that are making masks, they're reaching out and helping at food banks. And there's something about feeling like we can do something about the situation and be helpful and be purposeful that helps us as well inside. So look up positive psychology. I think you'll find some good examples there. Some other techniques, for one, just minimize the stress going in. Do not watch TV 24/7 and watch all the craziness going on out there. Sometimes having a routine, getting back into a routine, because that kind of creates a bit of a safety net there. Connect with others. We know this time it's difficult to do that as much, but we do know that that's very helpful. Think about, if needed, talking to a counselor or reaching out to your PCP, getting some additional help, or talking to a minister of some point. Sometimes, going back to our religious beliefs, and we've been separated these days from our synagogues and our churches and our places of worship. Maybe reaching out and trying to dive deeper in that area can be very comforting for folks. Exercise, getting a good laugh. We know that laughter always turns things around. Getting outside even. All the mindfulness and meditation, those kind of things really help as well. Journaling, that's very helpful. So some ideas. I'm not going to be able to obviously solve all the stress with this, but make sure you're kind of taking note of that and have your pulse on that as well. Another whole pillar of lifestyle medicine is social connection, because that is very important. We have actually found that lack of social connections and feeling lonely and isolated, even before this whole pandemic, really increases one's mortality. It's really not a healthy thing. And with the pandemic and folks feeling even more isolated, that's just gone up significantly. So both personally reach out for those relationships, and if you know loved ones or friends or neighbors, reach out. And the good news is it's even little contacts. I mean, we talk about little interactions in the store with someone. Any of those little contacts definitely just help improve that feeling of connectedness. One of the other thing I found interesting that was one of strong social connections is actually one of the largest determinants for one's own happiness, which I found was interesting. I think we just are made for relationships, and at a time when it's even more difficult to do so, we want to make sure to pay attention to that as well. So avoidance of risky substances. I mean, I really think this is a time where we prefer probably to just lay on our couch, eat mac and cheese and bonbons and whatever other comfort food we can find, and probably have a few beers or something and just not even move. But those are all these things we probably shouldn't be doing to keep ourselves healthy. Alcohol reduces the immune system. Smoking definitely does, as well as it hurts the lungs, including vaping. We don't know everything about vaping yet, but we know there are some negative consequences in your lungs. So again, if we get this virus, we want to have our best health going. So I know it's smoking, quitting smoking is a hard thing to do, especially in a time you're feeling more stressed and all that, but would be a good thing to concentrate on. One of the interesting facts that I heard too is when you smoke, you produce more of something called ACE receptors in your lungs. And why that's important is that's kind of the receptor that this virus needs to get into your lungs. So you're actually giving it more of a entryway, so to speak. So again, that's something, and we have shown that within 6 weeks of quitting, we see significant improvement in one's lung function. So there's some resources here. One of the The easiest resources is PA Quitline, and they actually have health coaches for free, as well as they sometimes will give out patches for free too. So that's something if that's an issue. Activity. And I've heard sometimes that, plant-based people, we talk a lot about our diet. We don't always give enough credit to physical activity as well. So want to make sure to remind us, about this. I think, exercise and all really helps our immune system. It helps us both prevent and treat various other chronic diseases. We know it helps lower blood pressure. It can help stabilize blood sugar. It can help with weight maintenance. It definitely helps improve our sleep as far as that goes, help with anxiety. A lot of positive benefits there. And actually, if you get out and walk or run in nature too, just being outside with that fresh air has a lot of immune boosting and positive benefits. The recommendations are to probably get some moderately strenuous exercise, about 150 to 300 minutes a week, maybe in 30-minute increments or so. But they have found that, even 20 minutes is enough to help the immune system, and any at all is better than none. So if you haven't been exercising, start somewhere. I think that there are a lot of good benefits to help us get moving. Let's see here. Okay, so we want to start talking, I know this is probably what most of you want to focus on, but I really felt like I wanted to talk about all those other domains as well that we might not talk about as much. So what are some of the nutritional recommendations? Well, before we go into what the recommendations are, we want to see where we are as a country, maybe not this group per se, but what the standard American diet, or more affectionately known as the SAD diet, is all about. So standard American eats about 73% of their diet is processed foods, which are very high in fat, sugar, and nutrients that aren't really nutritious at all. Another 25% are animal foods, which are usually very high in cholesterol and fat. 12% of our diet is in plants, but unfortunately only half of that is actually whole plants. The other is more processed plant foods. In addition to this distribution, the average American takes in about 185 pounds of sugar or sweeteners per year, over the recommendation of salt, usually found in a lot of the processed food. And the big thing is hardly any fiber. I mean, animal food doesn't have much fiber. Once you process food, it usually takes a lot of the good nutrition and fiber out of it. So most of our fiber is found in plants, legumes, nuts, seeds, some of those things, and we're getting a very small amount of that. The recommendation is about 40 grams of fiber. Most Americans get less than 10, about 7 to 8 grams a day. So that said, whoops, back up here for a second. I think this missed a slide. Oh, maybe I was just going to talk about, why do we, I think we're told that all these things are so healthy for us. They slap these labels all over just to really, because there's a lot of misinformation out there, because really, I don't think any of us really believe that Cocoa Krispies are going to give us better immunity. I mean, that's what, all the false advertising out there is just kind of maddening. They're even advertising this to kids, etc. So that said, what the standard American diet has led to is a fairly sad state of affairs in our health in this country. About 70% of Americans at this point are either overweight or obese. And the prediction is by 2030 that about half of the American population will be obese. And 1 in 3 of our children are actually obese. And the obesity rates kind of correlate directly to an exponentially growing, diabetes, heart disease, high blood pressure, all of those things as well. So we've become one of the sickest countries, and we spend some of the most money on healthcare. I know this looks a bit scientific, but I want to kind of talk to you about specifically what some of the standard American diet and sedentary lifestyle and stress and some of the medicines a lot of folks are on, kind of what specifically they do to the body to cause some of these chronic diseases over here on the right. And I don't know if anyone can see the slide. I know you guys are all blocking my the last part of that slide, but anyway, that's on the right side is all the chronic diseases that things tend to turn into. But the three different mechanisms. This is a big word, microbiome dysbiosis. You've probably heard of the microbiome, the gut flora, all the millions of different bacteria that we have growing in our gut. You might have heard of a term called leaky gut, when that microbiome is out of whack, and dysbiosis kind of means out of whack, unbalanced. We don't have the right proportions of the right bacteria. And things that cause that are everything from a very processed diet or a diet high in fat and sugar, taking antibiotics, and even when all the food we eat, if we eat much animal or dairy, that all has a lot of antibiotics in it. I've heard of statistics that I think it was 70 or 80% of the antibiotics that we produce go towards raising animals. So we're getting a whole lot of antibiotics through animal products if those are the things we are eating. The other things that kind of make this gut unhealthy is some of the medicines we take. A lot of the anti-inflammatories, everything from the Aleve and Advils up to the prescription arthritis medications. A lot of the antacids, the Zantac and Prilosec and Pepsids and all those things. So a lot of things, and then not getting enough fiber. What helps the microbiome is plenty of fiber, plenty of resistant starch found in beans and things that help rebuild the right distribution of bacteria in the gut. They've actually done, and I know this is maybe more information than you want to know, but they've done studies where they've made rats diabetic. And then to try to reverse that, they've done fecal transplants from a healthy rat to a diabetic rat, and that rat gets better with the right amount of bacteria now in their gut. So science down to that level really shows me there's something to that. And they say about 70% of our immune system really starts in our gut. That's kind of why I'm making a rather big deal about this one portion here. The other ways that we harm our system is oxidative stress. You've probably heard that. We talk about having antioxidants to fight those off, and antioxidants are usually found in plants. Cell injury from, again, a lot of processed foods, other lifestyle things, smoking, stress, the cortisol, all of those things. All these three things together lead to chronic inflammation, which is usually the underlying factor for all these chronic diseases, including obesity, diabetes, heart disease, cancers, depression, autoimmune diseases, and overall just a poor immune system. So basically the dietary recommendations to both optimize our immune system and to prevent, treat, or reverse chronic disease would be to eliminate these things over in red and to go green. So these things over here are foods that have high inflammatory effect. They're very low in nutrients, yet high in calories. And these over here have a lot more anti-inflammatory effect, high in nutrients, lower in calories. And here you have your meat, your dairy, your processed meats, a lot of sugar, and other processed foods with white flours and white sugars and such. Over here, it's all the fruits and vegetables, your leafy greens, your beans, nuts, seeds, all of your plant-based foods over here. So indeed, oops, didn't switch here. There we go. The best diet is one that has high nutritional value, low and empty calories, high in fiber, especially because of the gut stuff, high in antioxidants, high in micronutrients, which are a lot of your vitamins, again, found in plants, low calorie, low or no cholesterol, and low in saturated fat. And that would be the whole food plant-based diet. Another way to look at it, going on my, fighting a war kind of theme, is Dr. Furman talks about the G-bombs. And he's determined these are among the whole food plant-based diet. These are probably the foods that have the highest amount of nutrient value. And he's even come up with an Andy score. I don't know if any of you are familiar with it, but you can look that up. And he scores food with how much nutrients they have in them. He talks a lot about weight loss as well as fighting cancer and boosting immunity. So especially foods in these categories. And it's not even just one type of green though, eating like all the different greens. And these don't even have them all, but getting a wide variety in each category. Just have so many anti-inflammatories and antioxidants. Beans, legumes, and lentils, very high in fiber. A lot of the prebiotics and resistant starches that help us fix our gut issues here, be very helpful. The onions and garlics and shallots, all of those are alliums and have quercetin in it that are very immune fighting, have a lot of immune fighting powers there. Mushrooms are another big immune support. They've even actually done a lot of research with fighting cancer with mushrooms too. There's some breast cancer study that are kind of impressive. Even just one, I think it's one white button mushroom a day really helps significantly with reducing the recurrence rate of folks that have gotten breast cancer. Your berries and all the antioxidants found and things like that. Your nuts and seeds. Now this would be one that you probably, if either heart disease or weight was an issue, you don't want to go overboard. There is a little bit higher of a calorie density, so it's about 1 handful is usually what we're recommending here, but very high in zinc, selenium, some of the other nutrients that we need to help fight infection, as well as the omega-3s, which are very helpful for our brains. And I just included this. All the other vitamins from A down to the mineral zinc are important, and they are mostly found in a whole food plant-based diet. We do want to, though, just eat the colors of the rainbow. You want to pick many different red foods in different categories. The more variety, the better. The more different bacteria that we develop in our guts that help our well-being and our immune system in general. Another way to think about how to go about starting a whole food plant-based diet is the Power Plate. This is very similar to the USDA's, I think it's called a Healthy Plate these days. I can't remember exactly, but they have, half fruits and vegetables. They do have a quarter starch, and then they list a protein over here. And we would argue that the healthier protein would be your plant-based proteins, like your legumes. I really like this one. Dr. Greger does a very good job. And I've mentioned Dr. Greger a few times. For those of you who don't know Dr. Greger, he has a whole website called nutritionfacts.org. He and his team study all the nutritional literature every year, and they do reviews on his website. So anything you want to know about, you can Google in breast cancer or avocados or whatever. Very good resource. He's also written a book more recently called How Not to Diet. And I think I said it before, but his first book was, well, not first book, but one of his earlier books was How Not to Die. So this is his app. It's a free app. It lists the amount of different things you should have every day, and it's quite robust. I mean, it's 3 servings of beans, berries, 3 fruits, cruciferous, and it kind of goes down the line. And I'm not sure I get all that, but it is a good goal to shoot for. He even does a good job at the bottom. He comments on some of the vitamins. Both vitamin B12 is something most folks that are eating a strictly plant-based diet would want to supplement. And many folks that don't get much sun would need to supplement vitamin D. But those are probably the only 2 supplements that are recommended, as long as you're eating, again, a wide variety of things. The update in his app also puts in a lot of the tweaks that he found with his How Not to Diet book. What he did is he reviewed all the different diets and came up with all the criteria for a good diet, as well as all the additional tweaks, like, apple cider vinegar before meals actually helps. So again, he put it in there and he provided all the resources and the references to the studies that showed that. So that would be a good app to think about downloading. That would be a good guide to how to consider trying to implement a plant-based diet into your life. These are some vitamins that folks have started talking about, do we need to supplement these things to help us fight this virus? Most of what I've read these days, if you're deficient in any of these, yes, I mean, supplement, but I would argue more getting them for your diet, except maybe vitamin D. I mean, I personally take some vitamin D. I'm not sure I get enough sun to get adequate levels. These should all be found in a well-rounded whole food plant-based diet. And again, we don't specifically want to boost just one arm per se of the immune system. We're really looking at the variety so that the immune system's working stronger as a whole and working smarter. you know, any of the systems in the body, there's regulation. And I think we saw that one example of those natural killer cells kind of working too much. But I think if we make the immune system strong as a whole, it's going to kind of self-regulate itself a little better as well. So just kind of quick summary of what the benefits of the plant-based diet is. You know, I was talking mostly about helping the immune function tonight, but it truly both arrests, reverses, and prevents chronic disease. It decreases your cancer risk, and it decreases recurrence of cancer if you've already had a diagnosis of cancer. It can halt some of the autoimmune diseases, and that includes multiple sclerosis, lupus, psoriasis, a lot of those things. It lowers cholesterol and blood pressure. It improves constipation. It helps weight loss and weight maintenance. It even treats illnesses, and this kind of didn't make complete sense to me initially, but like asthma, allergies, acne, and reflux are significantly improved, especially dairy, with both like the asthma and the acne, I think significantly improved with less dairy. Age defying, and I actually didn't mention that, but down to a chromosome level, we have shown that folks who eat a whole food plant-based diet, their chromosomes don't shorten as quickly. What a normal aging process is, there's little things called telomeres at the end of your chromosomes. And over time, they shorten. They have shown that a whole food plant-based diet, they don't shorten as much. And the chemicals that kind of would make them shorten are less, and the chemicals that help repair those telomeres for shortening are more. So they've kind of gotten that down to a cellular level, which I think is kind of amazing. Longevity enhancing, trying to get rid of some of your medications by making some of these changes, increasing energy, helping your sleep, decreases stress, improves mood and mental clarity, and it's environmentally friendly. This is another just good infographic to kind of sum things up that you can download as well. This is the website. This is the American College of Lifestyle Medicine's website that, again, you can download any of those resources. Dr. T. Colin Campbell has a very good website. This goes on for several pages here. It has a lot of good articles about the immune system in general, of viruses, of just some things to do during this time. This is Dr. nutritionfacts.org, Dr. Greger's information on COVID-19 as well. And even the Food Revolution did a whole summit regarding that. So it's hard to judge when I can't see the whole audience how that was all received, but I am more than happy to answer any questions you may have.
There is a question, Karen asked one, when you were talking about heart disease. She asked, how does the diet help with heart valves? Is there evidence that valves get healed as well?
Heart valves. Heart valves, one of the primary causes of valvular problems is often rheumatic fever or an infection earlier in life. Not all, but that is one thing. Valves themselves, I cannot say that I know that there's evidence that it does. I mean, it will make your body, you know, just healthier in general, so you're not putting additional stress on your heart and some of the pressures, but I'm not sure it really gets in there to help a heart valve. I don't want to overstate anything here, no.
Katie asked, do you have any suggestions for reading and understanding nutrition labels? I find it very overwhelming, which it is, Katie. Yes.
You know, I don't know if I haven't, actually help me on that one, Sally. When you wrote your book, did you come up with something real specific there?
Yes, in fact, I'm going to be doing a workshop on reading nutrition, on reading labels. At some point for plant-based, because I've done it in the past. It's a really helpful one, what to look for. So Katie, stay tuned. Be on our, if you're not on our website signed up, do it. And we'll do that in the near future.
Yeah, because they're right. And they try to make them confusing. There's new guidelines coming out, some of which have been implicated, but I'm not sure they're all out. So.
Yeah. And the final question is from David, says, what are more examples of processed foods?
Okay, processed foods are a lot of white flour, white sugar, really anything that's probably in a package. I mean, we want to try to eat food
with a nutrition label.
Sorry?
You mean anything with a nutrition label?
Right. I mean, if you have to read the label, you know, not always, but usually it's somewhat processed anyway. The more ingredients, the more processed. The more you can't understand what ingredients they are, even the more processed. I think at least if it's going to have a label, I think at least if it says whole wheat, that's a little better than the other ones. I mean, if it says bleached wheat, unbleached wheat, all of that, that's pretty much white flour. So yeah, there are some foods, some breads, especially like your sprouted wheat breads, I think that are much closer to the real, real food than others.
Well, that was wonderful.
Yeah, very nice, very nice.
Very nice. And you got some people
Yeah.
thanking you also in the chat room there.
Yeah, you're also
Lisa.
speaking to the choir, you know.
I am, but I'm not sure the whole lifestyle other part of it. I mean, that's kind of why I wanted to include that. I mean, I realize that a lot of folks on the line are already bought into the plant-based, but I think we want to make sure we focus on our whole, our whole health too. So.
Yes.
Yeah. And there are a number of people that are brand new. That came from other that aren't plant-based.
Okay. Good.
So it was a very well-rounded.
Yeah, I mean, reach out to me, guys. You're welcome to email me. Yeah, if you have specific questions. I don't quite yet have all my social media out, but I'm going to try to go by a lifestyle medicine veggie doc when I do. My kids are trying to get me better connected there, so at some point.
Okay, well, I thank you. I thank the participants, and we look forward to next week with their more workshops. So,
Which one is it next week, Sally? That's ready.
We have the cooking. I'm sorry. Yes, the 21st is Brittany is doing the cooking on breakfast for dinner.
Okay.
Right, Brittany?
Yes, and I just put a link to register to that in the chat as well.
Yes, she did. Yes. And it is on our website under meetings. There's a link there. I'll put it on, I make a Facebook on our Facebook.
Sally,
Yes.
I was just wondering, I saw the article that was posted in
Yes.
gardening, about gardening as an alternative to, there's an interest in plant-based and gardening. Could we have a seminar on gardening, for example, and then some recipes from what you can garden? Because I really like to garden, but I don't know how.
Okay.
Yeah, because I think there's some people who are into that in the group, like Susan, like tips, or Chira, Phil. So to follow up on the article, and is it the Tribune Review?
The Tribune Review, had an article out on gardening, and he had interviewed me and Susan Greenberg. So yes, I will follow up on that, Lulu. That's a good idea.
It's very timely. The weather is changing. That's good for gardening. And also
Yes.
there will be shortage of food. That's what they said. I don't know. So.
Well, there's shortage of animal foods. Right.
Yeah.
So it's another reason. Yes, resources.
Yeah.
Right?
Was that? Which is good news.
Yeah, they're forcing people to get healthier.
Yeah, they get healthier.
Well, I mean, actually what they've shown though is, I mean, the same concept with how filthy, dirty the wet markets are. There's some of these plants. Yeah. So that's kind of the connection there, that it's kind of, I'm not sure ironic is even the right word, but that they're having so much problem with disease spread within a plant like that. So it's kind of interesting.
Okay. And there are, Karen, there are groups like Grow Pittsburgh, and I'll follow up with that. Yes, thank you.
Thank you, Lisa. It was very clear. Because
yes, very clear.
You know what? Not only that, Lisa, I'll make a confession. I've heard these things before, but it's good to be reminded, you know.
Of course, yeah. Yeah,
And also there are the visuals, you know, convince you about the different parts of the immune system, you know, and a lot of people are just targeting one part, and you're right. And because of the fad, the trends, they would say, oh, take this, take that. And it was good, except I was kind of sleepy a little bit. 7 is too late for me. So I think, are you uploading this your slides, or is it in a website?
Well, a lot of the slides really can be found on there's some of the handouts that American College of Lifestyle Medicine has on their website. So that's really the majority of it.
I mean,
the
that one on the immunity.
there to get the information. That's why I use them, so you'd be able to quickly get that.
Oh, okay, okay.
and next week, I'm reminded that Brittany is also doing a bootable Wednesday through our clubhouse. So if you're not a member, and it's open to anyone touched by cancer, you can sign up, be a member, and sign up. So you have an option of listening to Brittany 2 days in a row, which is always very good.
Is it
Okay.
in the website, in the plant-based website?
Well, Brittany's doing one for our clubhouse in the strip district, but you can sign up for that. She's doing one on bootables, right, Brittany? And then that's next Wednesday. Next Thursday, she's doing one for the Plant-Based Pittsburgh on plant-based breakfast.
Yeah.
Breakfast for dinner.
Yes, and I just put our clubhouse website again in the chat.
Yes.
Oh, okay.
Thank you.
Okay, thank you guys.
Okay. Thank you, everyone.
We'll see you.
See you soon.